Hey everyone, welcome. If you're watching for the first time, my name is Mariana. I have been working as a nurse for 3 years, and just this year I started a website called thenursingjournal.com to help students and newly grads to learn more about nursing. So if you want to be updated, make sure to subscribe and follow me on Instagram at nurse.mariana. In the meantime, today we are going to discuss pre-operative nursing care. And what this basically is the stage before the patient goes in for the surgery, okay? This can be weeks, months, hours before the patient is wheeled to surgery. But the whole aim here is to prepare the patient holistically. Like anything else in nursing, holistic care is very, very important. So here we are going to prepare our patients from the psychology, from the spirituality, and also medically. So we're gonna prepare our patient from all aspects, okay? And you're gonna be the patient's advocate. So you're gonna assess their needs, you're gonna investigate their risks, and try your best to make the whole surgical pathway go smoothly, right? But before we get into it, there's two differences that you have to know. And I think that they make a big difference. There is elective surgery, and then there is emergency surgery, okay? Elective surgery is basically surgery which has been planned a lot of time for months, while emergency surgery is something that has happened because of an accident and it has to be done quickly. So the nursing care in the two is going to be very different, and the focus is going to be different, okay? While here you have months to prepare, here most of the time you have hours or minutes to prepare, okay? But let's get into it. Today is going to be the part one of the pre-operative care, and we're going to look at the elective side, okay? So we're going to discuss patients that have been informed that they are having surgery in a few weeks or months. Okay, and the first thing that you have to check in the pre-operative phase is basically education. Education and educating a patient is insanely important, but a lot of the time it is overlooked. If you go on my website, I have linked a lot of research that indicates and shows that patients who are educated well before the surgery benefit a lot in the post-operative phase. They often spend less time at the hospital, they are more compliant to the exercises and mobility, and they also have better controlled anxiety. So go in and have a look at that. In the meantime, what you have to educate your patient about is basically the type of surgery, why it's being done, see what they understand, see if they understand the benefits of the surgery, and also ask the patient if there is anything that is concerning them, okay? A lot of the time they might be a bit shy to talk about it right away, so please note their body language, see if they're anxious, if they're moving a lot, if they're not making eye contact, if they're crying, of course. That is a sign of anxiety or fear. So this leads to the second stage, which is managing your patient's anxiety and fear. Okay, this is extremely important because having an anxious patient on the surgery table does not have the best outcomes. Research has shown that when patients are stressed about the surgery, then they're more likely to neglect themselves in the post-operative phase, and they don't really, accept themselves after the surgery, okay? So make sure that the patient's anxiety levels are controlled. And you can do this by going through breathing techniques, try music therapy, try exercising, and really anything that is gonna help the patient. Everyone is an individual, so take note of how your patient is reacting to what you say, okay? Some patients might be, over the top if you tell them that you have to walk a bit to calm down or try music, but others might be into it, and it will definitely help them. So, education and managing anxiety is something that's gonna go well together, okay? And now the third stage of pre-operative care is basically planning the post-op phase. Okay, you're telling me, we're here doing the pre-op, why on earth are we talking about post-op? Well, it is super important to prepare the post-operative phase, okay? Having your patient prepared before the surgery and knowing what to expect after the surgery is going to make the whole thing go a lot smoother, okay? And there's a lot of things that you have to discuss. Firstly, make sure to encourage mobility and exercising. Exercising after surgery is going to help the patient with their circulation, and is going to reduce the vein thrombosis, and it's going to reduce a lot of the risks. But of course, when they are in pain, it's going to be a bit difficult for them to exercise properly. So tell them that their pain is going to be managed. Any symptoms like nausea or anything else is going to be managed, okay? So exercise and managing. And then move on to the deep breathing exercises. There's been a lot of research that shows that deep breathing exercises benefit a lot, and they avoid pulmonary complications. So practice these before the surgery, so after the surgery the patient can do them very easily, okay? And then, just tell the patient what to expect, how the things are going to be after the surgery and what to expect. And lastly, discharge planning, okay? I cannot stress this enough. Discharge planning is insanely important in the pre-operative phase, because when the patient is done and he's recovered and he is gonna go home, there needs to be someone to help, okay? Whether it is to cook, to clean, or simply to see if he is doing okay, someone needs to be there, right? And if this person doesn't have anyone to look after him, especially if this person is elderly, then you should be looking out into ordering either services that are going to monitor the patient at home, or perhaps getting the patient into a rehab facility, right? So yeah, go through this in the pre-operative phase. Okay, and now we are at the fourth stage, and this is the physiology assessment. So as a nurse, you should be taking care of the patient's medical side as well. So start off by taking vital signs, check the temperature, check the blood pressure, heart rate and respiratory rate. Don't just write 18, check, okay? Check blood glucose if the patient is diabetic, and also check their BMI, okay? Having a good outline, a good overall assessment of the patient is really going to show any hints that might affect the surgery. For example, high BMI a lot of the time indicates problems either during the anesthesia or even after in the recovery phase, okay? Blood glucose has to be under control, otherwise the patient is going to have complications, such as the wounds not healing properly, or even issues during the surgery itself, okay? Any issues that you note, try your best to educate the patient on how to control it, and always discuss with the surgical team so they know things beforehand, and then there's a whole plan put in place to ensure your patient safety, right? Good. Now you are at number 5 of the pre-operative phase. Then this is basically tests. So there's a lot of tests that have to be done before the surgery to ensure that your patient can do the surgery, right? So start off with the routine blood test. This is going to give you a good physiology assessment. Then you have to go up to checking your patient's type and screen and cross-match, because if the patient is going to bleed a lot, then you have to have a type and screen ready, okay? Then if you want to give a transfusion, everything is set. Always have an ECG or an EKG. No anesthetist is going to put the patient to sleep without an ECG. So make sure that's in there. And then also look into specific surgery tests. A lot of the times they ask for chest x-ray. Some surgeons might need a CT or an MRI, PET scans. I mean, the list is endless. So make sure everything is booked and explain to the patient why they're being done. Explain that this is a routine, so they don't, go on and start worrying even more, right? So all of that has to be in order before the surgery. And now the last part of the preoperative phase, it is number 6, and this is basically the nutritional status of the patient, okay? So a lot of the patients will be doing a surgery under GA, so they will be fully asleep, general anesthesia. And for that, they have to be starved for 6 hours before the surgery, right? So inform the patient about the 6-hour starvation period, and then you have to think and you have to assess the patient. If you have a fragile patient, a diabetic patient, they cannot just be starved like that for 6 hours. So discuss with the surgical team to admit the patient early before the surgery, so you can start an IVI infusion, or what we call a diabetic protocol, to ensure that your patient is good with the hydration and that all the electrolytes are in place, right? And also check any surgery-specific diets. For example, a stomach surgery or a bowel surgery is going to require specific diet protocols before the surgery, right? Sometimes the patients are asked to be on only fluids or only clear liquids before the surgery. So just take your time, go through the surgery protocol and explain it bit by bit of it, okay? Now we're gonna move into the second stage, which is the immediate pre-operative phase, okay? And this is usually hours before the patient goes down to surgery, okay? This is just a quick checklist that you have to go through. So make sure that your patient has an ID bracelet with his name and identification number, okay? And the ward number. Check that he has an allergy bracelet as well, because if the patient is allergic to anything and he's asleep, he cannot tell you, right? So put a red bracelet to showcase his allergy, okay? And then once you have that, you have to check that the patient is shaved and marked where he or she is going to have the surgery, okay? Do not underestimate women. Make sure that women are shaved as well. They have to change into the hospital gown, a lot of the time removing the underwear. And that is basically most of the things that you have to check, and also that the patient has not been eating or drinking, right? So ask the patient those things and check that everything is in order. After that, you have to check the patient's file. And now here you are going to look for the patient's treatment chart and medical notes, including past history notes, okay? Check that the pre-op assessment is there, that you have the bloods available, the ECG or EKG or any tests that you will need. And just before everything is done, usually the hospitals have a checklist, okay? A checklist that you have to go through to make sure that all of that is in the file, right? And doing all that, you should be good. Your patient is now ready. You can just wait, have a coffee until they call you to take your patient down. So, thank you so much for watching. If you enjoyed the video, please give it a thumbs up and subscribe. Make sure to go on my website to get your study notes and follow me on Instagram to keep updated every day, okay? So, see you again next week for a new video.